Okay, so for this one, we're looking at her upper extremity for vascularity. For this, just like all of our other exams, we're just looking first observation, looking for any lesions or anything. We have our shoulders exposed and our armpits exposed. Looking for any lesions, skin discolorations, edema, any swelling of any sort on both arms going up to the shoulder. We're also looking for any trophic changes such as wrinkling. Edema also fits in that category. Anything abnormal with the skin. Next, we're going to check temperature. So for this, I'm just going to take the dorsal of the hand and feel both sides of her shoulder going down to her hand. Noting if there's any changing in temperature on either sides of the arms, which there was not. Next thing I'm going to do is look at her fingernails. And when looking at the fingernails, just making sure there's no red lines, lesions, any discoloration. Looking for any pitting of any sort. Next, I'm going to press down on her fingernail and then observe and watch the blood form back into the tip of her finger, just knowing that there's normal blood flow and nothing is getting blocked. Also, I'm going to check her hydration. For that, I'm just going to lightly pull on her skin and watch it snap back elastically. If she was dehydrated, this action of her skin snapping back, or if she was with elderly, this kind of something that happens when the skin loses elasticity, it wouldn't snap back as fast and it would kind of stay more as a tent. Next thing I'm going to do is check her pulses. So first I'm going to start off with the radial pulse. I'm going to take my two fingers and find a radial pulse. Feel for any abnormalities, any weird amplitudes, or anything of that sort. And I'm going to check her ulnar pulse. Feel anything, and nothing abnormal there. I'll then check her brachial pulse, just in the antecubital fossa. Have her bend her elbow slightly, and just feel inside there. Okay. Next, I'm going to check her epitrochlear node. This node is located between the triceps and the bicep. It should be about a small groove, about 3 centimeters long. Here, I'm just checking to see if there's any swelling or anything abnormal with her lymph nodes, just in that area. And I don't feel anything abnormal or anything that would cause concern. Next, I'm going to check her overall lymph nodes. And then for that, I'm going to start off with their axilla or her armpit. For that, I'm just going to have her raise her arm for me slightly. And now this might tickle a little bit. I'm going to kind of squeeze in there a little bit, try to make it not too painful. So for that, I'm going to reach in deep, palpate her axilla armpit. Feel the lymph nodes, feel for any abnormalities there. I'm then going to palpate her anterior lymph nodes and feel for any abnormalities. If you're more comfortable, you can cover your breast tissue. Otherwise, it does not matter. Next, I'm going to check her humoral lymph nodes, palpating down there to see if there's any abnormalities or anything swollen. And then I'm going to check her posterior lymph nodes, which is going to be on her subscapularis. For that, I got to dig a little deeper into her armpit. Sorry. Feel for any abnormalities there. And then I'm going to check her apical nodes, which is going to be a little more on top in the armpit. Check for any abnormalities there. Everything checked out just fine. Nothing abnormal. No hard lymph nodes or immovable lymph nodes. The last thing I'm going to check is I'm just going to do Allen's test for just her vascularity. For that, I'm going to have her raise her arm, and I want you to squeeze your hand for me. Keep squeezing your hand. I'm going to have her do that for about 30 seconds or so. Then I'm going to have you stop and just squeeze. Going to block her radial and ulnar artery. Bring her hand down, have you open your hand for me, and then unblock the radial. Observe the blood flow back into the hand, and then unlock the ulnar. And observe the blood flow into the hand, making sure that it's not abnormally long.